So I want to take a moment to discuss how to handle things like working with healthcare system when you have a loved one with dementia or cognitive impairment, Alzheimer's, who can't really advocate for themselves. And I am the medical power of attorney for my father. And recently we had a situation where a doctor had suggested something that required a epidural or some type of anesthetic to relieve some kind of pain. So he sees a pain care management for things like his neck, his knees, spine, things like that, based on a variety of things like past surgeries or being a Texas football player back in the when would that be, like 60s, 60s, and just living at an advanced age of things feeling not good anymore, right? And so he had a nerve ablation in his neck, and it was to alleviate some of the pain that he was feeling from has had past surgeries on his neck. And about 2 weeks after the ablation, he was still complaining of pain. The doctors didn't fully explain to his other caregiver that this is normal. Instead, they booked a follow-up to have an epidural and a steroid injection. And so his other care partner, who's wonderful, by the way, doesn't have a whole lot of knowledge about how Alzheimer's progresses and how things like anesthesia or things that cross pain management that crosses the blood-brain barrier can impact symptoms of Alzheimer's and even progress it to a point where they may never gain back the level of cognition that they had prior to that procedure. So I went to this latest appointment, and our goal was to seek alternative therapy instead of just blindly going into an epidural with a steroid injection. And there's a lot of other things that you have to consider in an elderly, more advanced age patient, because if they're a heart patient, if they are diabetic, which my dad has both of those in his medical history. So when we entered the appointment, our goal was to figure out alternative treatments that did not rely on medicine. So massage therapy, physical therapy, things like that. The neck pain was not impeding on any of his daily functions. So we had talked, his other care partner and I talked about possibility of including some of these other things into his, scheduled events or scheduled things that he has going on. So we got to the appointment. Not only was there it wasn't an appointment with the doctor, it was an appointment with a physician's assistant, which is fine. But it was a different physician's assistant. The prior one had left the practice. So she was kind of taking a lay of the land. And prior to her coming into the room, there was a medical assistant who came in and took some notes and just gathered some information prior to the PA coming in. Well, I can't tell you how many times my dad has been asked, what is the level of pain from yesterday compared to today? Does it hurt worse? They ask him these questions, and I don't know about y'all, but when you know that somebody has Alzheimer's, you kind of want to say, why are you asking a question that asks them to recall even 5 minutes before this conversation? Now, I understand there's different levels of Alzheimer's. However, if you're going to write down his response and take it as the response to make decisions from, then those people are not doing what they're supposed to be doing. his other care partner who attends, majority of his doctor's appointments because of availability. She has more availability than I do. Doesn't push back in this manner, and I was there at this time, and I modeled for her what I do. So what I said was, and put me in a very awkward position, and I need your help trying to find a solution, because I said he's not going to be able to answer that question. And I try to make him feel as maintain his integrity as much as possible, but in situations like that, it's tough, right? He doesn't wear a badge that says, I have Alzheimer's, be patient, or I have Alzheimer's, don't ask me questions and expect a reliable answer, or I have Alzheimer's and I can't remember what I said to you 2 minutes ago. So I said he won't be able to answer that question. Then the second question out of her mouth was, how does the pain compare to last week? I kid you not. How does that not resonate with caretakers? I mean, with medical staff. I'm not blaming the medical staff, please. They're wonderful people. This is not about them. It's about the training and support we give to people who are in these positions, and support that for them to understand what a caretaker goes through. This isn't the first time I've experienced this. When he had knee surgery, and the anesthesia coming down off the anesthesia, created a much more difficult situation for rehabilitation. And the doctors at the rehab facility kept asking him about how he felt compared to yesterday. And I said, sir, I kept telling them, sir, ma'am, whatever, I apologize, but he's not going to be able to give you reliable information. I can tell you from the caretaker standpoint, here are the things I looked for. At some point in that situation, because we were there for a couple of weeks in rehab, inpatient rehab, because of his Alzheimer's and his need to come back from this major surgery, and also come off of the anesthetics that were processing and floating around his brain. I said, I can tell you what the differences are from yesterday to today. But at some point, I became irrelevant to them. It didn't matter what I said. And that is unacceptable. There's not enough communication on how difficult caretaking is, on how taxing it is, because not only can you not rely on what they say verbally in an Alzheimer's situation, you have to be an observer. You have to look for things like, are they quieter today? Do they not want to do something? Is there irritation? So him getting flustered, it could be a million reasons. Are his pants too tight? Are his shoes, is there a rock in his shoe that's making him irritable? Does he have pain in his neck, his back, his heart, and I think we need better education on how to provide support, not only for an Alzheimer's patient, but their caretakers. So I get this comment a lot. I don't know if y'all do too, but I get this comment of, your dad looks great. He seems to be doing great. If you're holding a 2-minute conversation with him, just seeing how he's doing, checking in on him, he's going to seem great. He's going to seem with it. He's going to seem funny. He's going to seem, like good old Rick that everybody knows. But what they don't see is that 2 minutes later, he's going to ask you the same questions. He's going to forget that he even talked to you. He's going to do any number of things that we know exist with Alzheimer's or dementia. So in a medical field situation where they do have the knowledge to make things better for people, in which they do all the time, we need to advocate for our patients that are aging, that have this cognition fail. And when I asked this, the PA came in the room a little bit after that. She started asking him similar questions, and I said, he's not going to be able to answer that.